Hey, what's up, everybody? Dr. Corlin, cardiologist. Just want to talk about three very important cardiovascular tips that actually could save your life and the lives of the loved ones around you. Number one, actually understand what a cardiovascular risk is. These are items or these are diagnoses that put you at increased risk of having a heart attack. But first, you got to understand what coronary artery disease is. And even further than that, what exactly is a coronary artery? So, coronary arteries are the blood vessels that supply the muscle of your heart. And when they become diseased, they have an increased amount of plaque that ultimately could lead to a heart attack. So, what exactly could raise your risk of having a heart attack? So, we're talking about diabetes. If left uncontrolled, can definitely increase your risk of coronary artery disease and ultimately a heart attack. So, make sure you get your A1C checked out. Next, hypertension or high blood pressure. Blood pressure goals are at less than 130 over 80. So, when you're walking around in the grocery store and you put your hand in the cuff, see what you're roughly around. Hyperlipidemia, we're talking about uncontrolled high cholesterol. LDL and triglycerides are the bad cholesterols when you're looking at your lipid panel or your cholesterol panel. We want those lower. We're talking about HDL, that's the good cholesterol. You want that higher. Next is obesity. And if we're talking about obesity and you're eating a chocolate chip cookie right now, break me off half. Nah, I'm just serious. Yes, working out is very important, but also you want to actually watch what you're eating. So this makes a big difference in cholesterol, diabetes, and hypertension. You see how it all ties together. The next thing I want to talk about is something that may not be as preventable. I'm talking about family risk factors. So when you go into the clinic, whether it's your PCP or your local cardiologist, you know who in your family, we're talking about first degree relatives. So we're talking about siblings, we're talking about mom and dad. Have any of them had a heart attack at an early age? This makes a major difference in regards to what you could possibly inherit. And when you get your lipid panel, you can even get a lipoprotein A or LP little a. This is actually a genetic marker inside your cholesterol panel to let you know if you have a genetic predisposition in having cardiovascular diseases such as heart attacks. Number two, know your body. You know more than anybody else when something feels off. And I'd rather see you in the clinic than in the ER, let alone the ICU. It is your job to let me know if you're having chest pain. It is my job to figure out whether it's actually heart related chest pain or some other etiology. And that goes into number three. Not all chest pain is heart chest pain, meaning not all chest pain is related to you potentially having a heart attack or actually having a heart attack. There are multiple different etiologies of chest pain, including anxiety, including lung related chest pain in regards to pulmonary embolism or clots in the lung. It is your job and your responsibility to make sure that you get seen by the necessary provider. It is my job to figure out what this chest pain possibly could be. So I can't do my job without you doing yours. And I want to empower you guys to continue to always ask questions about your health, but you can never ask questions about your health if you never actually get seen. Hope this helps. Peace.